Welcome to iCare, Infection Control Advocate and Resident Education. In this lesson, we will cover nursing home response, outbreaks, and other emergencies. It's a cold and windy day at the Springville Nursing Home. Miss Stella Johnson, a resident at the Springville Nursing Home, has been working with Susanna, the nursing home's pharmacist and infection preventionist, on a special committee made up of other residents and family members. The committee has been providing input regarding how to better communicate and apply infection prevention to those with dementia. Things are going very well, and some great measures are being put in place. But the cold and windy weather has interrupted their planned meeting for this week. As Miss Johnson and Susanna discuss rescheduling the meeting, Mr. Robert Williams, Springville's nursing home administrator, rushes over to speak with Susanna. A winter weather alert has been issued for the area, and the nursing home's emergency preparedness plan has been activated. He needs Susanna to assume her role in the plan, including preparing for any possible infectious disease outbreaks if there are any disruptions in day-to-day activities. This possible emergency and Mr. Williams' comments worry Miss Johnson. She wonders what is needed to prepare and respond to emergencies in a nursing home. What are outbreaks and how can they be stopped? After this lesson, you will be able to answer the following questions. What are the elements a nursing home must consider to prepare and respond to emergencies? What constitutes an infectious disease outbreak, and how can they be prevented and controlled? Lastly, how can planning and participation respect resident rights while preventing and controlling infections? We have all experienced an emergency in one way or another, as individuals as well as members of a community. In order to plan and manage emergencies, it's important to think of 4 different emergency phases. The first phase is mitigation. Mitigation includes actions that take place before emergencies to prevent them and after emergencies to minimize their damage. Mitigation can include actions such as having fire alarms. The next phase is preparedness. Preparedness includes the plans to handle emergencies when they do occur, and of course, occurs before an emergency. Preparedness includes activities such as a plan for evacuating a building during a flood. The next phase is response. Response occurs during an emergency and is putting your plan in place to save lives and minimize damage. For example, a response action could be sheltering in place during a hurricane. The last phase is recovery. As you can imagine, recovery takes place after a disaster and includes actions to return to normal or to an even safer situation. Recovery can include actions such as having special structural reinforcements in a building located in an earthquake-prone area. The main point is that actions can be taken to prevent or minimize emergencies with the proper planning. In order for nursing home communities to manage emergencies through the 4 phases, mitigation, preparedness, response, and recovery, they must have an emergency preparedness program. The emergency preparedness program is made up of 4 core elements which should be written and documented. The first element is risk assessment and planning. For this element, nursing homes must complete a facility-specific and community-specific risk assessment using an all-hazards approach as part of their emergency plan. Nursing homes need to consider specific characteristics of their nursing home. What is the profile of the residents? This includes the number of residents and their physical and cognitive conditions and disabilities. What are their physical and emotional needs? This includes activities for which they may need assistance like bathing or going to the bathroom, and treatments like oxygen therapy. This also includes cultural or religious needs. Also, what are the capabilities of the nursing home? So, what are the resources they have to meet resident needs and their capacities? So, the max services they can provide given their resources. What services are offered by the nursing home to meet resident needs? This includes helping residents bathe or go to the bathroom. What is needed to provide these services in a competent manner? day to day and also during and after an emergency. This includes staffing, the functions they serve to meet resident needs, and training and education the nursing home provides to ensure the staff can competently provide services. What are the physical and environmental resources required to meet resident needs? This includes the physical building structure, services like telephone, but also equipment and supplies such as wheelchairs, gloves, gowns, and goggles. Lastly, what business infrastructures are needed to ensure care continues throughout an emergency? Again, the assessment must also focus on community risks and have an all-hazards approach. This means that the nursing home needs to consider risks in the general community that can affect the nursing home, such as increased COVID-19 in the community. An all-hazards approach means that a nursing home needs to be broad in their approach, and the risk assessment should not focus on one specific type of emergency, but instead how to respond broadly to emergencies specific to their geographic location. The risk assessment is used to inform an overall emergency plan. The emergency plan must include strategies to address the risks and priority emergencies identified from the risk assessment. The plan must also address how nursing homes will cooperate and collaborate with state and local emergency preparedness officials. Both the risk assessment and the emergency plan must be reviewed and updated at least once a year. The next element of the emergency preparedness program includes developing detailed policies and procedures. These policies and procedures must be based on the risk assessment, the emergency preparedness plan, and the communication plan. We will discuss the communication plan next. So, the emergency preparedness policies and procedures must address evacuation. If residents are evacuated to a shelter or other location, how will the nursing home track staff and residents? There must also be policies and procedures regarding sheltering in place if the nursing home cannot evacuate during an emergency if it is needed. Policies and procedures must also detail how medical documentation will be shared to protect privacy throughout and after an emergency. To ensure the nursing home is able to continue care, policies and procedures must be put in place regarding surge staff and volunteers. In the event the nursing home cannot provide care, policies and procedures must address arrangements for another facility to provide care. Lastly, policies and procedures must be updated and reviewed annually. Another very important element of a nursing home's emergency preparedness plan is the communication plan. The communication plan provides communication details needed to ensure coordination of care for residents. The communication plan must include communication within the facility, but also external to the facility with stakeholders, including healthcare providers, public health, and emergency preparedness officials. The communication plan must provide contact information for residents, staff, volunteers, and major stakeholders external to the nursing home, such as emergency preparedness officials. The communication plan must detail the type of information that is needed and will be shared with others, including healthcare providers, for continuity of care. A nursing home must also detail how it will communicate the status of its abilities to provide care, as well as needs during and after an emergency. Lastly, nursing homes must communicate their emergency plan with residents, families, and representatives. But it is up to the nursing home to determine what to share regarding the plan, when it is shared, and how. Like other elements of the emergency preparedness program, the communication plan must be reviewed and updated at least annually. The last element of a nursing home's emergency plan is training and testing. Nursing homes are required to provide training to staff, volunteers, and others who provide services to the nursing home. This training must include areas of the emergency plan as well as policies and procedures in which these individuals play a role. While training provides awareness and education regarding the emergency plan, testing is required to make sure staff and others know how to take the actions for which they were trained for. Nursing homes must have a way to demonstrate knowledge of staff and others, for example, through an exam. Nursing homes must document training and demonstration of knowledge. One last component of testing is conducting drills and exercises. Nursing homes are required to conduct some kind of exercise or drill twice a year. With the exception of these drills and exercises, all other components of training and testing must be conducted annually. One very last thing to mention is that nursing homes must also include how they will implement emergency and standby power in their emergency response plans. Now that you know the basics of a nursing home's emergency preparedness program, it's important to understand the unique role of emerging infectious diseases in this plan. COVID-19 is a perfect example of an emerging infectious disease. But there have been other emerging infectious diseases such as pandemic flu and even Ebola. Emerging infectious diseases will continue to be a threat to nursing home communities as many residents are at high risk for severe outcomes due to their age and underlying health conditions. A nursing home's emergency plan should consider that emerging infectious diseases can be localized to a small area or widespread and affect the state, nation, or the world as we experienced with COVID-19. Because of this, it is important for emergency plans to clearly state how nursing homes will plan, coordinate, and respond to emerging infectious diseases with state and local public health and emergency preparedness officials' plans. Some recurring considerations for emerging infectious disease response include an increased need for equipment and supplies such as personal protective equipment like gowns and gloves. Secondly, the possible need to screen and test residents, staff, and visitors should be considered. A change in both transfers and discharges should be planned for, and the need to coordinate with providers, including home-based healthcare settings, should be planned for. Lastly, the physical environment of the nursing home should be evaluated as part of the emergency plan. The ability to isolate and have physical distance. This also includes surge capacity in terms of having sufficient staff to respond to an emerging infectious disease emergency. Staff will also be affected and may be ill or have ill family members they must care for. What really causes issues with an emerging infectious disease, or really any infectious disease, is the occurrence of an outbreak. But what is an outbreak and how can they be prevented and controlled? Well, an outbreak is just more cases of confirmed or suspected disease than expected during a specific period of time and in a group of people or location. This can be 3 or more cases of influenza in the nursing home in the last 3 days among staff or residents, or this can also be 3 or more staff or residents presenting with new respiratory symptoms in the last 3 days. For rare or serious diseases, an outbreak can be just one case of the disease. Even when several cases are needed to meet the definition of an outbreak, a nursing home should consider the potential for an outbreak to occur due to one case and act in an effective and timely manner. For example, a case of diarrhea and vomiting in a resident who does not typically have these signs and symptoms should prompt a response to prevent and control possible transmission of a stomach bug or germ. Several prevention precautions can be put in place in a nursing home to prevent and control the germs that cause outbreaks. These precautions focus on stopping spread by targeting how the germ is spread or transmitted, directly or indirectly. To learn more about these precautions, please see the other eye care lessons that are available. One last thing to note when it comes to infectious disease outbreaks. Having good communication and collaboration with public health officials is very important, as they can help provide insight and resources to help stop an outbreak. In addition, certain cases of infectious diseases are required to be reported by a nursing home for further investigation. Outbreaks must also be reported to public health as well as nursing home licensing officials. Nursing homes are also required to assess and plan for a special type of outbreak due to waterborne germs, in particular a germ called Legionella that causes a disease called Legionellosis or Legionnaire's disease. Legionnaire's disease is a pneumonia disease that can cause serious health outcomes, including death in residents, as they are at higher risk due to their age and other chronic conditions. Because of this, one case of Legionnaire's disease is considered an outbreak in a nursing home. The bacteria thrives in water systems where the bacteria can accumulate and reproduce. This includes things like pipes, valves, cooling towers, but also fountains, shower heads, and even medical devices like CPAP machines. These bacteria can then be spread when a person breathes in small water droplets containing the bacteria. In some residents that have trouble swallowing, the bacteria can also spread when water is aspirated into the lungs. To reduce the risk of waterborne germs like Legionella, a nursing home must have a water management plan. The plan must include a risk assessment of the water system. The nursing home must identify ways to minimize risk to residents by implementing a water system maintenance plan and also control procedures as needed. So now that you know about the requirements of a nursing home emergency management program and plan, emerging infectious diseases and outbreaks, and the important role of water management plans in preventing outbreaks from bacteria that thrive in water, what does that have to do with resident rights and responsibilities? All residents, those closest to them, including the nursing home community's staff and administration, want high-quality care and deserve an environment that promotes high-quality care. Reaching the highest level of quality in a nursing home community includes taking all steps to prevent and control infections. And as all nursing home communities experienced during the COVID-19 pandemic, infections occurring not only inside but also outside the nursing home community can result in changes that impact a resident's rights, such as visitation and freedom to participate in activities. These changes can have a major impact on a resident's overall well-being. When nursing home communities work side by side with residents and those closest to them, such as family members, to prevent and control infections, this demonstrates a commitment to quality care that preserves and promotes resident rights. And when resident rights are protected and preserved, this also strengthens a nursing home community's ability to prevent and control infections, resulting in balanced, quality care. When infections are prevented and controlled to deliver high-quality care, two major resident rights are protected: participation and planning. Residents have the right to be part of a nursing home's emergency preparedness plan. Resident care must be a major focus of the plan. Residents, as well as family members or their representatives, also have the right to receive communication about the nursing home's emergency plan. Residents and their family members also have the right to meet as a group to discuss the plan and voice any concerns. Residents and their families have the right to provide input into a nursing home's risk assessment, which guides the emergency preparedness plan. While regulations do not require participation, nursing home residents and those closest to them have the right to request involvement and provide feedback to the nursing home as part of the nursing home's required system for feedback on resident care quality. Lastly, nursing home residents and their families have a right to participate in infection prevention and control precautions and participate in education provided by the nursing home related to infection prevention and control precautions. Quality care can only be achieved when nursing homes have a strong program in place to prevent and control infections and prepare for emergencies. Federal and state laws require nursing homes to have an emergency preparedness program that assesses, plans, and collaborates to provide residents competent care on a daily basis, including during and after an emergency. An infection prevention and control plan that includes a risk assessment for different emerging infectious diseases and possible outbreaks, as well as measures to prevent and control germ spread. Lastly, a nursing home must have a water management plan that is based on an assessment of the water system, minimize risk of waterborne diseases to residents, maintains the water system, and controls issues when they are identified in the water system. Let's return to Ms. Johnson, who is preparing for worsening winter weather. For 2 days, the Springville nursing home is hit hard by a severe winter storm. But Mr. Williams, the nursing home administrator, recently updated the nursing home's emergency response plan to account for an increased risk of winter weather and a change in resident population. He worked with others to update the plan as it was needed to ensure Springville is able to provide care to all residents, including a new memory care unit. Residents and their families were provided flyers highlighting important changes to the plan. Mr. Williams also presented parts of the plan at resident and family council meetings. In addition, residents and their family members were asked to provide feedback to the risk assessment and participate in a short exercise testing the Springville Nursing Home's communication plan. While the storms disrupted some activities and caused some staffing shortages, overall, things went well. Ms. Johnson recalls the communication exercise and knows that the Springville Nursing Home communicates their needs and abilities with emergency preparedness officials. This makes Ms. Johnson feel comfortable with how Springville planned to provide the care she received during the storm. And after a month of tracking infections at the Springville Nursing Home, Susanna is happy to report to both the resident and family councils no outbreaks were reported as a result of the winter storm. Thank you for watching this lesson. Please see the iCare website for additional lessons, information, and support.